Ciao mondo, hello world, hola mundo, hello mom. I'm here in Florida looking at the cloudy sky and I'm started thinking about the importance of climate changes on the kidney patients. Well, first of all, we have seen that heat waves may actually influence not only the level of hydration and therefore have an impact on the incidence of acute kidney injury, for example, in elderly patients, but we also have seen this affecting the hemodynamic response in dialysis patients when, for example, excessive high temperature may affect their blood pressure, and in fact they have a limited response from an autonomic dysfunction syndrome that may condition their efficiency in counteracting changes in temperature. On the other hand, we know that these heat waves may influence the availability of water, especially in areas like Africa or Central America or deep Asia, where actually the availability of water is not as it is in Western countries. And for this reason, in fact, studies have been showing that we need to spare water in dialysis. We need to try to develop new type of therapies that may actually help the patients to have access to therapies even in conditions where the climate changes may not actually favor their clinical situation. At the same time, when you have a increase in cool heats, for example, in winter you have a very stormy weather, you have flooding, or you have low temperature, the immune system seems to be affected by this, and in particular patients who have a delicate immune system. I'm thinking about patients with transplant that receive immunosuppressive therapy, but at the same time patients on dialysis or chronic kidney disease that by definition have a limited response capability. I think that in these cases the climate changes may actually affect their outcomes. In general, I think this is a totally unexplored area, but the message is that the climate is changing, and we are coping with some syndromes in some cases, including flu epidemic in winter or specific gastroenteritis in summer that we were not used to see in the past. We have to deal with this, we have to find solutions, we have to learn how to cope with these climate changes. With this, thank you very much for joining today, Cappuccino. It is just a reflection on the future of our patients and our planet. Have a wonderful, wonderful day. Excellent.